S'ajourne maintenant. L'honorable député de Fredericton.
Thank you, Madam Speaker. On October 23rd, I asked when this government will be implementing national standards for long-term care. I was pleased with the response from the Parliamentary Secretary to the Minister of Health, and I'm eager to hear him expand on his comments. But first, I'll take a moment to underscore the gravity of the situation facing workers and residents in long-term care homes. I speak today as a Canadian, as a New Brunswicker, as a granddaughter, as a human being. This conversation must be centered squarely on the needs of people. COVID-19 has asked us to face ugly truths about our society, ones we knew existed, but were happy to ignore until, sadly, for many, it was too late. As we know, it is older Canadians that face the greatest risk when it comes to COVID-19. Despite early warnings, our statistics demonstrate that while individuals 80 years and older represent only 12% of all COVID-19 cases to date, they make up 71% of the deaths. While only 15% of COVID-19 cases in Canada have been in long-term care facilities themselves, they still represent 77% of all COVID-19 deaths in Canada. We know the seniors living in these homes, of which are around 2/3 women, are vulnerable. Unfortunately, the people tasked with their care and protection are also vulnerable. A recent report demonstrated that up to 90% of direct resident care in long-term care facilities is provided by resident aides or personal support workers. These professions are notorious for their low wages and part-time hours. Of note, almost 90% of these workers are women, often from racialized and marginalized groups, including newcomers. 25 to 30% work more than one job, and 65% report having insufficient time to properly complete care tasks. We are failing to support vulnerable workers to succeed, and in turn, we are leaving older Canadians with inadequate access to care. I always like to bring these numbers home. As a resident assistant in New Brunswick, long-term care home will make between $14 to $16 an hour. They will work enough hours over the course of a year to bring home just $24,635, which is $6,000 less than the Canadian average for their colleagues in other provinces. And to put that into perspective, it's only a little more than half of the 2018 market basket measure for Fredericton. The New Brunswick Nurses Union recently released an eye-opening report, blowing the whistle on the state of long-term care in New Brunswick. Even though a 2019 study by the Canadian Health Coalition identified 4.1 hours of care per resident per day to be the minimum standard for quality care, the number of care hours prescribed by the government of New Brunswick is only 2.89, and some homes are unable to meet even that low standard. It is clear that long-term care homes, both private and public, take advantage of low-income, part-time, often marginalized workers. They struggle to maintain a full staff complement because the work conditions and pay are so meager. They do not balance their teams of RAs and PSWs with adequate numbers of LPNs and RNs to handle the increasingly complex care required in these homes. The residents see fewer and fewer hours of care time with staff. Their conditions worsen. Then in a pandemic, we see front and center just how vulnerable they can be and what real risks emerge. This is a question of how we treat our elders. This is a women's issue, but at the end of the day, Madam Speaker, this is about human dignity. Dignity for the residents of long-term care homes and dignity for the workers. I have used data points from several different organizations, many of whom have called for elements of long-term care to be pulled under the Canada Health Act. Many of these groups have called explicitly for the implementation of national standards. On October 26th, I added my voice to that of the Canadian Health Coalition, the Royal Society of Canada, the Council of Canadians, among others. The Parliamentary Secretary confirmed for me that day that his government would work with the provinces and territories to continue setting new national standards for long-term care. Can he please expand on those efforts? Thank you.
The Honourable Parliamentary Secretary to the Minister of Health.
Thank you very much, Madam Speaker. And as I've said in the past, I really value this member and the work that she does in the House, and I know that she puts her money where her mouth is when she says that this is something that is very near and dear to her heart. Madam Speaker, Canadians expect and deserve to receive the best quality of care no matter where that care is being provided. And that's why it is absolutely critical to take action in long-term care in Canada, working with provinces and territories. The pandemic has revealed long-standing issues in long-term care. There's no doubt about that. We saw this spring a number of facilities were not prepared to prevent and manage outbreaks. Facilities were frequently understaffed. In addition, lockdowns prevented family caregivers from visiting, making these staffing problems even worse. Infection prevention and control guidance weren't always being followed. In some homes, rooms and bathrooms were shared, making containing the spread of outbreaks extremely difficult. And as we saw, the most vulnerable in our society suffered the consequences. In light of COVID-19 and respecting provincial and territorial jurisdictional lead, the federal government has been working collaboratively, as I've said in the past, with our provincial and territorial partners to protect vulnerable Canadians in long-term care. During the spring, the Canadian Armed Forces members were deployed into long-term care facilities in order to assist with facilities experiencing the most difficulties controlling the spread of COVID-19. During the current resurgence, we are working with the Canadian Red Cross to support provinces and territories facing outbreaks in long-term care. Up to $3 billion in federal funding has been provided in support to provinces and territories to provide wage top-ups for low-income essential workers, which includes frontline workers in long-term care facilities as well. In addition, the Safe Restart agreements have been reached, which included $19 billion in federal investments to help provinces and territories restart the economy while making Canada more resilient to waves of this virus. Madam Speaker, this included $740 million in funding to provinces and territories to support our most vulnerable populations, including infection prevention and control measures in long-term care, home care, and palliative care. The Public Health Agency of Canada has published guidance to support the care of residents in long-term care facilities, as well as for infection prevention and control in long-term care and assisted living facilities, as well as in-home care. This guidance was developed with the National Advisory Committee on Infection Prevention and Control and endorsed by the Pan-Canadian Special Advisory Committee. In order to support changes to infrastructure in long-term care facilities, the Investing in Canada Infrastructure Program has been adapted to provide provinces and territories with added flexibility to fund quick start short-term projects, including health infrastructure such as long-term care facilities. Federally funded Canadian Foundation for Healthcare Improvement and Canadian Patient Safety Institute have launched an initiative to spread promising practices in preventing and mitigating the impact of COVID-19 on long-term care and retirement homes. The goal of this initiative is to prepare participating facilities to be better able to prevent and manage any future outbreaks. And we're going to continue these efforts, Madam Speaker. In the recent speech from the throne, the government announced its intention to work with the province and territories to set new national standards for long-term care so that seniors get the best support possible. We will also look at further targeted measures for personal support workers who do an essential service helping the most vulnerable in our communities. We must better value their work and their contributions to our society. Our government is committed to working in collaboration with provinces and territories to address pressing needs in long-term care facilities and to exploring measures to increase the resilience of long-term care facilities and help prevent such significant challenges from ever recurring again.
Fredericton.
Thank you, Madam Speaker, and I thank my honourable colleague for his comments and commitments. This pandemic is underlying the deep inequalities rooted in our communities, including the lived realities of those connected to the long-term care sector. I realize that what I'm asking for is bold, but that's what we need. Bold leadership that centers decisions around people. We need national standards in long-term care that will address the dignity of residents in their final years of life and respect the dignity of the workers. And we need elements of the Long-Term Care Act sector brought under the Canada Health Act. But leadership does not occur in a vacuum. We need to pair these changes with bold leadership on other fronts. The implementation of a guaranteed livable income will ensure Canadians have the means to enter their elder years on the solid foundation of life lived with access to shelter, food, and essential medications. National Universal Comprehensive Pharmacare would ensure no one is forced to compromise essential medications or just to make ends meet. A national mental health strategy that recognizes that mental health struggles are health struggles with dedicated resourcing to ensure Canadians can finally get the mental health that they need. I know it will be a tough sell to the provinces as well. I know Premier Higgs in my home province has already indicated as much, but Canadians need it and they want it.
Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Madam Speaker. And as I've said, our government is committed to helping our most vulnerable receive the best possible care in long-term care facilities. Our government has taken, as I've said, and will continue to take steps to respond to the significant challenges faced by long-term care facilities across the country in order to help avoid a repeat of the experience of spring of 2020. This commitment has been reaffirmed through the Safe Restart agreements, which include investments to support infection prevention and control in long-term care facilities, as I said earlier, and through the speech from the throne, which outlines the intention of working with provinces and territories in setting new national standards for long-term care. Residents in long-term care facilities should get the best support possible, no matter where they reside. We will also look into targeted measures, as I've said, that better value the work our personal support workers do in helping the most vulnerable Canadians across the country. Thank you, Madam Speaker.